Chances are that if you're listening to this, you are suffering some degree of hair loss. It's nearly unavoidable for us as human species to not lose hair. Obviously more common for men than women, but that may not be the case always. Women often have longer hair and can tend to cover it up a bit. But what I want to do in this, what I'm calling an educational appetizer, is just to talk about the current state of affairs of some of the options for treating hair loss. Obviously, we're all aware of the hair transplantation surgeries and procedures that can be performed, but what I want to talk about are some medical type treatments. This is just for educational purposes only. Obviously, each person's unique physiology, underlying health, and condition is individual and needs to be individualized for best results, and that requires a discussion with your healthcare practitioner. But nonetheless, I just wanted to jump into a few things. These are in no particular order. They're not in a hierarchical, most effective discussion, but I just wanted to share my experience as somebody who works in a healthcare capacity, primarily in men's health, but also across the global spectrum as well. But the first thing that we're all quite familiar with is a topical finasteride, commonly known as Rogaine. This is a 5-alpha reductase inhibitor. What this does is it keeps testosterone more in its native form and prevents it from shifting into DHT, which can cause miniaturization and sort of damage the hair follicles and result in thinning hair and brittle hair. That's very commonly utilized. The other is Minoxidil orally. This is relatively new in terms of hair loss, at least from an off-label perspective. A lot of companies are now offering this as an alternative to the topical Minoxidil. The reason being are severalfold. It's likely more effective, and a fair number of people irritation of the scalp when they're using the topical Minoxidil. It can cause some dermatitis, inflammation. Some people will develop what they feel is increased dandruff type scenario, and they don't like it. Obviously, it's generally recommended to be done twice a day, which for most people, myself included, taking something twice a day is often difficult. So that's where oral minoxidil comes in. It's an interesting drug. It was originally designed to treat high blood pressure, and that's why it has some of its peculiar side effects. There are black box warnings on it, and you can see one of the other videos I did here on YouTube where I talk about some of the black box issues surrounding oral minoxidil dosing. The topical minoxidil does get absorbed systemically, but probably to a lesser degree. Depends on which study you're looking at. Obviously, most of us don't have access to blood testing to see how much of something we're putting on our scalp gets in. It depends on quantity, strength, underlying health of the scalp, and a variety of other factors. Next is microneedling. Microneedling is just exactly what it sounds like. These are very small needles, usually on a roller device, usually just a few millimeters in length. And the theory is that they can stimulate the underlying tissues to sort of release growth factors. There are stem cells in the scalp that produce hair, and the combination of topical solutions along with microneedling has been shown in some studies to result in a more robust effect. Obviously, caution is evident here. You're talking about needling tissue, or obviously risks of infection. Depending on the density of hair or hair loss, this can result in some potential bleeding, depending on how vigorous a person is attempting to do this. So certainly discuss it with somebody who's experienced with microneedling and to discuss what approach may be the best for your particular situation. Keep in mind that when follicles are dead, they're generally dead. So if a person has been bald for 30 years, it's not likely, at least any scenario that I've seen other than hair transplant, that these follicles are going to be reinvigorated and return to a normal function, producing normal hair. So unfortunately, I see a lot of people who have been bald for a large number of years that are spending a significant amount of money on a variety of over-the-counter and prescription medications with the hopes that they can regrow some hair. So just discuss that with your provider as well. Botox treatments is quite interesting. I think the theory is that increased blood flow to the scalp, particularly to the follicles, can enhance the ability of the follicles to produce hair. There are certain conditions that result in contraction of some of the musculature in the scalp and can create some pretty impressive wrinkles, more common on the top and the back of the neck. But Botox has been used by some practitioners to sort of relax the tissues and to enhance blood flow. That's the theory anyways of how it works. Also similar to Minoxidil. Minoxidil, through mechanism of increased blood flow, is theorized to result in better nutrient delivery to the follicles and therefore potential for preservation of hair. The same concept applies to light therapy, whether this is a laser cap, a laser device, or some other device. The theory is that it's going to stimulate the scalp and can increase blood flow to the scalp with the potential of enhancing potentially hair growth, or if not that, at least mitigating hair loss. Keep in mind that not all of these are going to result in robust hair regrowth. That is individual. Some of it's genetically determined. Obviously, underlying health, nutritional status, and all those things play a role. So it's impossible to give a statement of guarantee that any particular treatment is going to work for any particular individual, because, as I mentioned at the start of this episode, that things need to be individualized based on each person's unique scenario. There is another medication called dutasteride. It's commonly used for urinary issues, but also a fair number of men like it for hair loss. Some companies don't utilize that drug because of the increased incidence of sexual side effects. Just depends on the dose. There is a range of doses for all these medications, and that's something that really needs to be customized to a person's particular scenario. Next is ketoconazole. This is an antifungal. There are always fungal elements on the body, particularly the scalp, and ketoconazole is theorized to help with some of the fungal elements and sebum production. Sebum is just an oily substance that's found on the skin itself and provides a water protective type barrier, but it's theorized that by decreasing this somewhat, the hairs may become more robust and grow easier out of the follicles. It's interesting that for some people, the side effect of ketoconazole can be brittle hair, so it's not a across the board benefit for people. So the last thing I wanted just to touch on is caffeine. Caffeine obviously is ubiquitous in society, and it's in a topical format, often combined with other elements, can be utilized as a hair loss prevention strategy. So it comes in different strengths and different concentrations, and is typically massaged into the scalp simply by drinking an extra latte in the afternoon. This is very unlikely to result in a concentration in the scalp and the hair follicles that's going to be beneficial, other than perhaps causing an excessive state of stimulation due to the excess caffeine. Obviously, people who are on nicotine replacement and other things need to utilize caution and discuss this with their provider. The two in combination I've unfortunately seen in the emergency department producing seizures where people have nicotine patches on and drink excessive caffeine and Red Bull and perhaps smoke a few cigarettes and can have some pretty impressive side effects. So I just wanted to go through this in a relatively rapid fashion as more of just a taste of what is out there. Obviously, there are a variety of factors that impact hair loss, hair prevention, and regrowth strategies, all that depending on physiology, genetics, environmental factors, and other things that really need to be sussed out with your individual provider. So I hope you found that helpful. Take care. Be well.